Hello, everyone. Welcome to Your Health in Your Hands. I'm Dr. David Achibade with the Brain and Body Foundation. Now, if you remember, like about 4 or 5 months ago, President Trump came down with COVID-19. And of course, there were different reactions to this. But the point I'm trying to make is that he was rushed into the hospital and they started giving a whole cocktail of drugs. Amongst them was remdesivir, which some of you may have heard of. In this segment, you're going to hear a lot about it and a lot about the person who is heading the team that is developing the drug and that is making the drug available to people and institutions and hospitals around the world. And it's especially my privilege today to introduce to you my friend Dr. Anu Osinusi. Hi, how are you doing?
Hello, Dayo. Thank you so much for the invitation and the opportunity to be part of a guest on your show today. I'm really excited to be here.
Well, we've been looking forward to this for quite a while, haven't we? How many months have you been pushing it off? Let me just out you in front of the whole of Nigeria.
No, not putting it off. Like, this is going to be a very special show, and I'm really happy to be here. And thank you again for the opportunity.
Well, thank you for making it finally. So, tell us about yourself. Let's see. As they say in Nigeria.
I'm actually an Ekiti girl. Both sides. Both my parents are from Ekiti, from Yhiyh, Ekiti. My dad is from Yhiyh, Ekiti. My mom is from Efwalaye. But spent many decades of their lives at the University of Ibadan. They went there and they never left, so they're still there. And I grew up in that in the University of Ibadan campus as well, and went to school on the campus, primary school, secondary school, and university. So up UI, I'm a proud alumnus of the University of Ibadan College of Medicine. And then after my medical school degree, I moved here to the US for first a little bit of a foray into public and global health. So I went on to get my master's in public health at the Harvard School of Public Health, and then spent a few years working on global and public health initiatives in the field of HIV primarily. And then after that, I went on to do my internal medicine residency at the Rush University Medical College in Chicago, Illinois. And after that, went on to do my infectious disease fellowship at the University of Maryland. And then, post my postgraduate training, my interest has always been in clinical and translational research, trying to develop drugs that are able to treat life-threatening diseases such as HIV, viral hepatitis, hepatitis B, hepatitis C, and now more recently COVID. So I spent a few years in academic medicine doing clinical and translational research in those fields. And then a few years ago, I made the transition to work in a clinical research team developing drugs for all these different diseases at a company called Gilead Sciences in California. And in my current role, a vice president of clinical research, and I oversee our COVID-19 program, including the work that we're doing with Remdesivir.
Remdesivir, that's the drug that we're talking about. That's the drug President Trump used. Former President Trump used, right? And it helped.
Yeah.
I mean, you must have been super excited about the fact that he was using your baby, right?
Yes, no, I think the story of Remdesivir is really just a testament to, what the world can do together, like creating possible, because it's the work of thousands and thousands of researchers, scientists, medical doctors, nurses, research staff, regulatory agencies, all coming together towards a common goal of advancing science while also trying to create a drug for a new disease that we'd never heard of until, a year, like 14 months ago, in a very tough environment and with a lot of morbidity and mortality, and trying to get that through as quickly as possible, but also safe and effectively as possible. So it's a testament to the work of thousands and thousands of people, and I'm really glad about the opportunity to be part of that story.
No doubts, no doubts. But you are still overseeing it, and I really commend you and applaud your humility and modesty where this is concerned. But we want to know more about this. We want to know more about how that eventually got to be, and hopefully maybe your plans for the future. And I know that this is not going to be the last pandemic, unfortunately. I mean, we can only hope that it won't be, but the way things are going, it may be, it may not be. So I'm hoping that we can talk more about how you see the trends, infectious diseases, what we can learn, or what we need to learn from this present pandemic going forward, and what are the lessons for third world countries like ours. And I have to say this because I think we've been super, super fortunate in Nigeria and Africa as a whole. I remember Melinda Gates was saying that she was afraid that we should start seeing people dying, dead bodies lying in the streets, because if the Western world was able to have a handle on the disease, I mean, what's going to happen to third world countries like Africa? So we've been fortunate. We don't know all the reasons why. Maybe you can shed some light to it as we talk about this, as to why Africans are spared the way we've been spared. But definitely there are lessons to be learned. So I'm hoping we can get into that a little bit. But at this point, we are going to take a short break, and we'll show a video from a very grateful ex-patient who came down with COVID-19. So see you guys soon.
Yeah, my name is Franca Ayuto. I'm 55. I tested positive to COVID-19 on the 27th of November 2020. Immediately, my doctors administered hydroxychloroquine, azithromycin, 1000 milligram vitamin C, zinc, vitamin D3, all that I took religiously for 4 days. On the 5th day, I was supposed to return for a follow-up check, but on the 5th day, I was very ill. I was ill. I was feeling that there was no breath in me, and I was coughing uncontrollably. And so I was rushed back to hospital. Immediately, I was placed on oxygen. And the first hospital didn't have a knowledge of what to do with me. They were just going to repeat the same drug. So on a superior advice, I was moved to the COVID center, the main COVID center in Abuja, which is the Gwagwalada specialist hospital, because it's attached to a specialist hospital. And when I got there, I met a doctor, Hamid, I think, who introduced this Remdesivir treatment. They told me how expensive it was. Then it was 350,000 naira for one ampoule, which is about $1,000 by the official exchange rate. And I was to take 6. Which is about $6,000. I was expected to cough out. It was huge, but then anything for my life. So we quickly gathered that, and they started with two of the Remdesivir, like a booster dose, and immediately I felt a lot of relief. The coughing ceased. I could breathe well, but though I was still on oxygen, I was sweating. I could talk to my sister. I could sleep, and I felt a lot of relief. And then by the time I took the second, third, fourth, fifth dose, I felt very well. On the 6th day, the oxygen was put aside. I could move around, though I was weak, because they had also to give me the steroids, because they said my lungs were already closing down. So I felt good, and the drug really did wonder. We called it the wonder drug here. I am very grateful to the doctors that treated me. I am particularly thankful to Dr. Anu Osinibi and her team who researched and discovered this wonder drug. I am very grateful because I don't know what would have happened if I hadn't gotten that intervention of the Remdesivir. I'm very grateful. Thank you. Please keep on the good work.
All right, welcome back. Now, isn't that a wonderful testimonial, Anu?
It sure is. It definitely is. And I think, each time that you hear about like stories where people, individuals recover from this disease called COVID, it just gladdens your heart, right? Because it's not only like, for me, like each person that gets COVID and gets sick with COVID, that person has a family, right? That person is not just an individual, it's affecting not just that individual, but their families, their communities. So just hearing her story, I think was very inspirational, and it's good to see that she came out with a positive outcome.
And she is super thankful. But I'm sure you hear stories like this almost every hour of the day, right?
Yeah, it's those stories that keep us all going. I think, one thing I can say for my colleagues here at Gilead is that, yes, I mean, everyone, it's a very experienced, brilliant, really smart workforce. But I think what really keeps people going that sometimes gets missing is just the passion and the dedication for patients and their families and their communities. That, like the patients are our North Star. Like that's my North Star. That's the North Star for my team, because they're tough days, they're challenging days, they're ups and downs. Like this whole journey of Remdesivir has been up and down, and it's been challenging. A pandemic, doing all this with a pandemic. But when you recognize that every second that you can go faster and get to that answer quicker means something to someone else. Like it means something to a patient, it means something to a family, it means something to a community. And that community could very well be yours. It could be your family member as well. So we never lose sight of that, and you just keep forging ahead regardless of the challenges and obstacles. I think when you have patients as your center and your North Star, that makes you overcome any of the negativity or the challenges, and just drive things forward. So it's really great hearing her story, and it's those type of stories that really just keep us moving on.
Without a doubt. Awesome. All right. So Remdesivir was initially a drug developed for Ebola. Is that correct?
Yes. So I can tell you a few interesting facts about Remdesivir. So Remdesivir itself it's an antiviral drug that inhibits a key mechanism in a lot of RNA viruses. Things, there are different types of viruses, and we call these ones RNA viruses. So it inhibits a central key activity of that virus as it's trying to replicate. But the other good part about Remdesivir is that it's also broad spectrum. So it actually works against multiple classes of viruses that cause life-threatening diseases, and one of that is Ebola. So when you look back to the story of Remdesivir, it's been, drug development is a very long process. It takes on average about 12 years from when you discover a molecule to get it approved. So, the Remdesivir work had been going on for a while when we discovered that it had activity against Ebola. And I think, at Gilead, we have a 3-decade history of virology, what we've done in HIV, what we've done in hepatitis. And so when the Ebola epidemic in 2014 was happening, we looked through all these compounds that we have in-house to see what can we do to also be helpful in that epidemic at that time happening in the Congo. And one of those things was Remdesivir. And so, but the way it is with epidemics, by the time you are ready to start trials and go through all, your initial work in the preclinical space, clinical space, sometimes those epidemics die and they're gone. So that's really what happened in that first step with Ebola. But what we learned then was to partner with regulatory agencies, partner with partners across the world, the WHO, doctors, Medicine Sans Frontières, and so that when the next one happens, we'll be ready to see if this is actually a drug that helps. And so, we used it in the 2018, 2019, and what we saw from those studies then was that there were actually some other molecules called the monoclonal antibodies, which is a different class of drugs that worked better than Remdesivir did. So those drugs have now been approved for Ebola. But then when this epidemic, when we got the first case, I think that was the first email that I got was December 31st. I will not forget it because it was the last day of the year, saying that there were these cases of what's called mystery pneumonia, was a WHO alert in a province called Wuhan in China. And immediately thinking like, okay, if this is a coronavirus, we actually knew that Remdesivir from animal studies worked for coronaviruses. If this turns out to be a coronavirus, we actually could be able to help. Never thinking that this was going to be this global pandemic, but recognizing this was happening in clustered places in China. And then it started building up, right? And the WHO recognized that it's actually a coronavirus. So we started testing, and then it just became a global pandemic. Well, very early on, there were three things that we decided we had to do at Gilead. One was to determine if it worked for this new coronavirus and do it as quickly as possible and as safely with all the regulatory aspects intact as well to be able to get it to patients. The second thing was that we needed to manufacture at risk because Remdesivir is not an easy one to manufacture. It's an intravenous drug that you have to take the lead time to manufacture it takes 12 months essentially. And we had 5,000 vials of drug in January of last year. And so you have to make this
when you
decision.
When you say at risk, you are saying that you don't take a chance because it hasn't been approved. It hasn't. All you know is that it works in animals. You didn't know whether it worked with human beings at that time.
Exactly. So that's what I mean. So we were entering the clinical trials, and usually you want to ramp up when all that is done. But if you waited till the studies read out with something that is a 12-month lead time, it's 27 different unique chemical processes to manufacture it, and some of them are sequential, so you have to do one to get to the next one. And if you totally wait till then, we wouldn't have Remdesivir. We'll just be having very limited doses at this point in time. So, that's the thing about the company. The company decided, our leadership, we're going to do this investment. If it doesn't work, then yes, that's an investment that you're not going to take back, but that's fine because it's the right thing to do. What if it does work?
Let me quickly ask, what would 5,000 vials, is that if it's something you can't reveal, then that's fine. But when you say risk, financially, what would that risk you are taking, financial risk, in making those 5,000?
Yeah, so at that time we had the 5,000 vials left over from our prior studies.
Okay, got
and so that 5,000 vials would only be helpful for a few people that are going to be on clinical trials, and then we had really a lot of challenges about supply because we had very limited supply. So we had to ramp up that manufacturing, and of course where we are now a year later is we're able to meet the global supply, but that's because of all those investments that we had to make right then and there. So
before you knew whether or not it would work, or it would be approved. Got it.
Yes, and we also decided we had to do responsible access, right? So, at that point in time, there was much more of a demand than we had enough drug, and people were getting very sick. And so we started something called a compassionate use program, where people were given the drug, giving the drug away. But even as we are manufacturing, making sure that we could distribute it as ethically as possible as we can. But in parallel, working as we were ramping up those manufacturing internally, working in parallel with our generic manufacturers to be able to supply remdesivir for across the globe. So working domestically and internationally to ensure that we had a much more robust supply chain that would be able to meet the demand. So those are things that we put in place very early, and then we partnered with multiple different teams across the globe of scientists to try and get the answers. Did it work? Was it safe for COVID? And I'm glad we were able to get that done very quickly, and so it became the first approved agent for COVID in the U.S. And it's also still the first antiviral approved for COVID. And so now it's been approved in over 50 countries across the globe.
Wow, that's impressive. And this is all you were always throughout the process. You are the leads. Let's put it that way. This process.
Yes. So the lead for our Remdesivir program, but again, as I say, it's a team of amazing individuals that are totally passionate and dedicated and committed to getting it done. And it's not just the people doing the clinical trials and the operations; it's the folks in the manufacturing working all shifts. Like it was 24-hour shifts of teams across the globe, 24/7. That didn't, as one team is handing off, the next one is coming in to make sure that we're able to ramp up manufacturing. It's the regulatory team. It was a company effort. Everyone came together across the company to ensure that we were able to get this done as quickly as possible for the greater good, and to be able to get this to patients across the globe.
Well, a big shout out to your team over there and Gilead overall. I'm sure lots of people all over the world who are grateful that you did what you did. So we're going to take a short break now, and we'll be back for a few minutes. So folks, do not go away. Welcome back. All right, so I know he's talking to Dr. Osinusi. Never going to get used to that. Dr. Osinusi has been talking to us about the whole story about Remdesivir and how our team over at Gilead are doing a fantastic job pushing it all out. I know how much of this is this? I mean, if you can reveal it, is that like a monthly quota that you say that you produce and send out each month? Is there something like that? Of vials?
Yeah, so I think that's a really good question, Daria. So what I would say is that, currently with all the work that we were able to do and ramp up manufacturing, we've been able to meet the demand for Remdesivir. At least we're able to get there before the end of the year. But in parallel, I think what is more relevant to to Nigeria, for instance, is that what we did with Remdesivir, similar to what Gilead actually has done over the years with HIV and hepatitis C products that we have, is partnering with generic manufacturers to be able to also meet that global demand. And the way we do it is really just a tech transfer and making sure that you select generic companies. Primarily, they're in India.
So we're not there yet, but we're getting there. Is that what you're saying, in terms of getting the generic drugs?
Well, so Nigeria is on. It becomes so it's one thing to make something available through generic manufacturers. On the other end, it has to be within Nigeria, and the regulatory agencies within Nigeria, and the folks deciding the health policy in Nigeria to see if Remdesivir is one of the drugs that they do want on the arsenal for COVID-19. So there are drugs that are available, but not every country necessarily wants that drug in their country or registers that drug in country, because it still has to go to NAFDAC, has to review the dossier, and all the regulatory authorities decide on which drugs are brought into Nigeria. But what I will say is that from the Gilead end, those 9 companies that we have partnered with primarily in India. Nigeria is one of those countries that can access remdesivir at a very low, affordable rate through the generic manufacturers. And you see some countries have done that and have, brought in a lot of remdesivir to their countries in that 127 list, and some other countries have not. And unfortunately, I can't really speak to the situation that is on ground in Nigeria. I think someone else will probably be better able to speak to that. But the whole goal is to make it affordable. Of course, what then happens around retail and markup within the country and the drug flow sometimes can be concerning as to how these things then get right to the final consumer, because it's supposed to be produced and manufactured at a very, made available at a very affordable rate.
Right. Well, Doc, we're going to have to end this particular show at this point. First of all, thank you, Anu, for making the time, and I know even your weekends are super busy. So thank you again. So God bless. Take care. Bye.